Hi guys, welcome back. My name is Dr. Samantha and I am the maternity mentor. We are back for another one of our Monday live Q&A sessions where we are here to answer questions that you have submitted on our videos in the comments section over the last week. We're also here to answer any questions that you guys might have live. So if you have any questions, please feel free to put them in the chat box. Remember, we're publishing new content and we try to come out with a video every Tuesday, so keep an eye on that. Like and subscribe to the channel and hit the notifications button so you can be the first to receive that information. Remember to share our channel with your friends and family, and we have additional content on Facebook, Instagram, and Twitter, so please follow us over there. Again, I'm Dr. Samantha, and I'm going to get started with your questions that you submitted this week. Remember, put any questions you have in the chat and welcome. So we're going to start off with antibiotics this week. So we get a lot of antibiotic questions, so these are good. So let's start. My doctor prescribed me fluconazole 150 milligrams, one tablet for 2 days at 20 weeks and again at 24 weeks. As she said, I had a yeast infection. But she did my swab twice and all the results came back negative. On checking, she can see redness and a small cut with white thrush on the upper and lower vulva with itching and discharge. I was on pelvic rest since 17 weeks, so no sex and no penetration. This time she prescribed clobetasol external cream, which I used for 3 nights. It's burning all day with a stinging sensation unless I wash this cream out with baby soap. My discharge and white thrush is getting better, but the burning has increased. What should I do? So, yeast infections are extremely common during pregnancy. The hormones that we need in order to sustain a healthy pregnancy change the vaginal flora. That's the normal bacteria that lives there. And it also changes like the dryness and the kind of feeling of the vaginal tissue. This is why when you have intercourse, it's often common for you to spot a little bit because the tissue is thinner and drier. Additionally, one of the things that happens when we're pregnant is we have a baby that's sitting on our bladder. So it's very common for women to report that they will leak urine throughout the day. They also may leak urine when they sneeze or cough. So as a result, it's very hard sometimes for pregnant women to stay super clean. Some women will choose to do extra washing in the vaginal area, thinking this can help. You'll find that women use douches, soaps, perfumes. These are all not very good for you. Another thing women will use are pads. They put pads on their underwear in order to absorb some of these secretions or urine. So the thing is, all of this stuff does not allow the vagina to breathe. Our vaginas need to have a lot of air going to them in order to maintain a healthy balance. So one of the things that's recommended is that you wear cotton underwear and you change your cotton underwear at least daily, if not more often. You want to try to sleep without underwear at night. This allows the vagina to kind of breathe and frankly dry out a little bit. So these things can help. And next, if you're experiencing some kind of infection, unless you've been directed by your healthcare provider to specifically use soap, you don't necessarily want to always use soap in that area. That might be contributing to the burning. That tissue may now be raw from some of the medications that you've needed to use. And as a result, you may have inflamed the tissue, and then the medication is a very strong kind of steroid medication, that clobetasol, and that might be why you're feeling that burning. You want to talk to your healthcare provider and find out if there's any other products that you can use. For example, you may be able to use just a tiny bit of the clobetasol right at the spot that you're seeing that white thrush. In the other area, you may be able to use something like diaper cream, which may help to reduce that inflammation. As far as yeast goes, I see that you received 2 doses of the fluconazole, which is great. But sometimes if it's a treatment-resistant yeast, you may need to use something a bit longer. The other thing you may want to ask your healthcare provider about is whether you can just simply use an over-the-counter medication. Sometimes the over-the-counter creams may actually work better for your yeast infection versus using that strong steroid cream that they provided. No douching. If you have been douching at all, douching is not good for your vaginal flora, and this can increase the risk of getting a yeast infection. So you don't want to be doing that. And if that's one of the things that you're doing, you want to go ahead and you want to stop. Make sure that you're wiping gently when you're going to the bathroom, because it sounds like you're very inflamed. One of the things we give to women after you've had a baby is something called a peri bottle. It's basically just a squirt bottle. It's soft plastic. It's got a little spout. We fill it up with soapy water, sometimes plain water, depending on the mom. And then you just go ahead and you squirt it on the vagina after you've used the bathroom to help rinse off the urine. It's a more gentle way because after you've had a baby, even with a cesarean section, your vagina is sore. So if you're experiencing an infection and your tissue is now inflamed from that infection, you might also benefit from using a peri bottle as well. So you want to think about that kind of thing. The other thing you want to ask your healthcare provider about is the use of ice. So ice on the vagina can help with swelling and pain. It's very homeopathic and natural. You wouldn't want to be doing this a lot, but a little bit of ice, maybe once a day for like 10 minutes, might be really soothing on the vagina and help to calm that tissue down. So I want you to just go ahead and, you want to talk to your healthcare provider, and you make sure with any medication that you're using, if you're getting some kind of symptom and you're not sure if it's normal, you want to let them know, because that burning pain that you're experiencing might be an allergic reaction. On our skin, we look for allergic reactions as like a rash, but you're not necessarily going to notice a rash on your inner labia. And therefore, you might want to talk to your healthcare provider also to make sure this medication is still right for you. So that was a really good question about fluconazole. I have another one about fluconazole. I take fluconazole 150 milligrams single dose during my days of my ovulation. Can I still get pregnant during these days? Okay, so you can get pregnant during your ovulation. You can get pregnant pretty much. You have to plan like you could get pregnant at any time. So we have this part of our cycle where we release the egg, and the egg travels down your fallopian tube. And usually if you have intercourse at a certain point in your cycle, when the egg is still in the fallopian tube, the sperm travel up, they fertilize the egg, and then the egg continues to travel down to the uterus and it implants. However, some women will ovulate twice, okay? Some women will release more than one egg. Some sperm will last longer than others inside. You can't 100% predict exactly when you're going to get pregnant. We have an idea. Science helps us, especially if you're tracking all the symptoms, but you can't 100% predict. So if you're trying to avoid fluconazole use when you get pregnant, my suggestion is you talk to your healthcare provider about what alternative you could use, period. So in my practice, one of the things I do is preconception counseling for women who are on psychiatric medication. So this includes stuff like ADHD medication. So ADHD medication is not safe for use during pregnancy, whether it's a stimulant or a non-stimulant. So when I'm talking to these women, one of the things that we have to do is come up with a strategy for dealing with their ADHD symptoms while not using medication, because I can't use any of the ADHD medications with them. I would apply the same principle here. If you're trying not to use the fluconazole while you're getting pregnant, you guys have got to come up with some kind of alternative. So one of the questions I would be asking is, why do you need it every single month? I would ask about the risks and the benefits and see what alternatives there are. It is kind of rare to need fluconazole, which is usually used for yeast infections, every single month. And continued use of any type of antibiotic or yeast medication can lead to a resistance. That means that when you do develop a yeast infection, the yeast will be hardier and stronger, and the regular medications won't work. So I would talk to your healthcare provider and see what kind of alternatives could be used. Our next question is about amoxicillin. So I was prescribed amoxicillin, 1 tablet, 500 milligrams, twice a day for an ear infection. I'm 29 weeks today. Is it okay to take this medicine? For 10 days, my doctor also said I had an acute upper respiratory infection. Okay, so this is a good question. So let's talk about antibiotics. So when you are prescribed an antibiotic, that means your healthcare provider has determined that you have a bacterial infection. Antibiotics cannot treat viruses. They can only treat and kill bacteria. Once you receive an antibiotic, you need to make sure you take all of the antibiotics, the entire dose. So the nice thing about antibiotics is you start to feel better almost right away. The bad thing is this can make you think like you don't need any more of the medication, but you do need the medication, because what happens is the antibiotic in the first day or so kills off most of the bacteria, like 80 or 90%, which is why you feel good. But there's still like 10 or 20% hanging around. And those 10 or 20% are figuring out how to get out around the antibiotic you're taking. So if you stop right then and there, they figure out what to do. They start multiplying, and in a week, you're sick again. Only this time, when they give you the same medication, that antibiotic does not work. Then you need a stronger antibiotic, and those stronger antibiotics may not be as safe for you or your baby. So this is why it's important that in the early stages, when you're getting that first antibiotic, you make sure you take all of it as prescribed. So ear infections are very commonly bacterial, so that is an appropriate use of an antibiotic. Upper respiratory infections, those depend, but again, it sounds like you're very sick, which is why your doctor has prescribed this to you. Amoxicillin is safe for use during your pregnancy. It's one of the safest antibiotics out there. It's extremely effective. You just, again, want to make sure that you take all of the medication as prescribed. All right, very good question. So we have another antibiotic question. I was prescribed azithromycin for my infection. I am currently in my 3rd trimester. Is it safe for my baby? So one of the things a lot of people mention when they're asking about medication safety is they mention how far along they are. 1st trimester, 2nd trimester, 3rd trimester. So the reason why everybody gets a little bit worried is because they're worried about birth defects. So the 1st trimester is the biggest time for a lot of structural development in your baby. It's the time where it's most likely that a birth defect would develop. So as your pregnancy gets further along, it is very likely that the risk goes down for birth defects to develop because of medication. However, you need to understand that sometimes we give a medication to prevent other things like preterm birth, miscarriage, stillbirth. So just because a medication has some kind of risk for birth defect doesn't mean it's not what we need to use. There's always a risk versus benefits type of thing. So when your healthcare provider is prescribing a medication to you, you want to ask that question. What is the risks versus benefits so that you can make an educated choice? Untreated infections can lead to sepsis in mom. Excuse me. Sepsis in mom is where you get a blood infection that affects your organs. If left untreated, it can cause serious illness or even death in mom. And of course, if mom is not doing well, baby is not doing well. So it's very important, even with the minor infections, that we get them taken care of right away. Now, let's say you get prescribed a medication. You really want a second opinion. What do? Another great resource for you is your local pharmacist. Pharmacists receive a lot of medication education, just like your healthcare provider. And they're often a great resource for you to get additional safety information. Going back to this question, azithromycin is an antibiotic that can be used safely during pregnancy, and we use it a lot. So this is a medication that you can take. Now, one of the things that you want to be aware of, if you're pregnant, a lot of women have morning sickness. and that's really like all day sickness. So when you're taking an antibiotic, like I just said, you want to make sure you take all of it as prescribed. But if the antibiotics are making you super sick, you want to let your healthcare provider know. For one, if it's a once a day tablet, they're probably going to tell you to take that medication at night, right before you go to sleep. So hopefully you can sleep through that nausea. But if you have to take it more than once a day, they may be able to prescribe you a short-term use of a nausea medication to help keep that in your body. So again, it's very important to take it as prescribed and make sure that you are checking in with your healthcare provider if you're not feeling well. Welcome to anybody who's just joining us. Remember, you can put any of your questions into the chat. I'm going to move on to our next question from our viewer. We have a viewer. She commented on the bed rest video, and what she said is, I've had 4 miscarriages. The last one was 2 weeks ago at 20 weeks of pregnancy. I've had an unsuccessful cerclage. Do you have any advice for me for the next pregnancy? So I think this is a very important question, and I'm really, my heart goes out to this viewer who's experienced 4 miscarriages. It's extremely difficult for any woman to go through it. And unfortunately, it's so common that many women know what that feels like. So when you've had multiple miscarriages, hopefully your healthcare providers have referred you to specialists to kind of check things out. You want to see if there's anything going on that you can help to correct that might be causing these multiple miscarriages. You know, miscarriages are often the result of a genetic issue with the baby, something that we're not going to find right away, or some kind of birth defect that our body senses before we ever even know it's happened. One of the most common causes of birth defects, it comes from a lack of folic acid. So women are told over and over and over again, make sure you get all your folic acid, take your prenatal vitamin, it's very important. Lack of folic acid can cause neural tube defects. This includes malformation of the brain or even absence of a baby's brain, as well as spinal cord issues, including when the spinal cord is like open to the air, like there's no skin covering it. So it's very important that you get folic acid early, because that's when those things develop. Now, one common cause of folic acid deficiency is something called MTHFR. And MTHFR is basically when an individual has a genetic issue that causes them to not be able to absorb folic acid like everybody else. So I kind of describe it as, imagine that folic acid is a soft serve ice cream, and you get that soft serve ice cream with that chocolate shell over it, that hard chocolate shell. So most people can just bite into the chocolate shell to get to the folic acid, which is the ice cream. People with MTHFR, they're not able to get through that chocolate shell. They have trouble with that. So they basically need to use a different type of folic acid called L-methylfolate, kind of like a broken down version of the folic acid that they can absorb better. So if you know that you have this, what you can do is, in combination with your prenatal vitamin, which has folic acid in it, you can also take an L-methylfolate supplement. Now, the other reason to go ahead and see one of these specialists is to determine, is there anything else going on? Do you or your partner hold some kind of genetic trait that the two of you together may be having a higher likelihood of your baby having some kind of disease? Is there, something going on with you physiologically? So you mentioned that you had an unsuccessful cerclage. A cerclage is a stitch around the cervix, and I'm going to talk about that in a minute. That this came in on the bed rest, the bed rest video. So one of the things I would ask is, why would you need bed rest? I mean, if you're working a very high stress, on your feet, 8 hours a day, 6 days a week job, yes, that could have contributed to what was going on. So you want to look at all these other factors, and these specialists, they know how to do that, and they can do that for you. And then you also want to look at some risk factors, like were you ever exposed to any kind of chemicals or anything else that could have led to this, okay? So make sure that you're checking in with one of those specialists and, make sure you're taking your vitamins. If you're overweight, try to lose weight, eat a healthy diet, all that good stuff, okay? So let's talk about cerclage, because this viewer mentioned that in their question. So a cerclage is basically a stitch around the cervix. So you have the uterus, and at the bottom of the uterus is the opening to the vagina, and that's where your cervix lies, okay? So a cervix should be long, thick, and closed, okay? Now, of course, it has some kind of opening, because eventually this cervix has to open to allow a baby's head to come down, but it's supposed to be closed. And an incompetent cervix is a cervix that starts to open up, okay? So for a cerclage, what we do is we stitch it. We basically stitch around it to sew it closed. It's just like you would imagine hemming like a pair of pants or something. It's a surgical thread with a surgical needle. Now, what happens is it's stitched closed, and then right before you deliver, usually around like 37 weeks, your healthcare provider will go in there and just snip that stitch off and then allow the body to do what it needs to do. If you were to go into premature labor early, they will cut the stitch early. So a lot of women will get this if they've had an incompetent cervix. So an incompetent cervix is usually a cervix that starts to thin out, dilate, and open prematurely in the actual pregnancy. Now, there is a different type of cerclage, which another viewer actually commented on one of our videos, which is called a transabdominal cervical cerclage. So this is like a more reinforced cerclage, okay? So it's like got multiple stitches to it, and then it's attached kind of up into your belly. Like your abdomen is your belly, and trans abdomen is like going across your belly. So it's stitched up a little bit. So it has a very high success rate. So a lot of people are like, well, why don't I just do that if it's got a high success rate? Well, with every single procedure, there are some risks. So there's a risk that you will actually break the amniotic sac. That's where the baby lives inside your belly. So inside the uterus, your baby's in a bubble of amniotic fluid. That fluid serves a very important purpose. So babies don't need that fluid to live. A baby can live inside your belly with just the umbilical cord and the placenta. If you have a healthy placenta, that's the organ that feeds the baby. The umbilical cord actually transfers all of the nutrients your baby needs. So then people think, well, why do I need the amniotic fluid? Well, it does protect the baby from infection. There is bacteria growing in your vagina and your uterus that's supposed to be there, but your baby isn't necessarily supposed to be exposed to it. So it helps prevent your baby from being exposed to that bacteria, which might cause an infection. Secondly, that allows the baby to breathe and expand the lungs. Okay? So when your baby is in the belly, your baby starts to practice breathing. And during that time, it breathes in that amniotic fluid, which expands the lungs. It allows those lungs to open up completely and go back down. Now, the reason for this is so that the lungs grow. A baby who does not have amniotic fluid to breathe and expand their lungs won't form their lungs properly. And this could lead to lifelong breathing issues when the baby is born. This is one of the major reasons why babies will have significant issues if the water breaks before, 22 weeks. Because at 22 weeks, the baby may or may not be able to live outside the belly, but there really hasn't been enough time for the baby to be able to develop the lungs properly. And if there hasn't been any amniotic fluid for a couple weeks, that could be a significant issue. Now, the other thing the amniotic fluid does, that amniotic sac, is that it helps the uterus to grow bigger as the baby grows bigger. So it kind of like pushes out the uterus for you so that the baby has more space to grow. Babies who don't have that amniotic fluid around them, what happens is the uterus kind of stays more small, and their space is very compressed, and they will end up with growth restriction. Now, back to the transabdominal cerclage. So when they're doing this stitch, they could potentially break the amniotic sac, and that leads to those complications that I just told you. Additionally, you could start bleeding. They could do what's called a cervical laceration. That's a cut on the cervix that can actually cause very significant bleeding and become a medical emergency. They could have some issues when they're stitching the actual part of the cerclage to the abdomen. So the cerclage is done through a little tiny, like 2-inch incision, kind of around the same spot a C-section incision would happen. And so it is still a surgery. Usually moms have no problem. They recover very easily. It's not a big deal, but it could be. Any surgery comes with risks. Now, this surgery cannot be done laparoscopically. It needs to have that little incision. One of the things you need to know if you're thinking about requesting a transabdominal cerclage is that means you're having an automatic C-section. There is no vaginal delivery with this. And that's something you need to understand. And a lot of us think like, oh, C-section, no big deal. They do them all the time. It's fine. I'll just have that. Cesarean sections come with significant risk. Okay. It's not a decision to be taken lightly. And often once you've had one cesarean section, you are stuck having cesarean section deliveries for the rest of the time that you're having babies. You're at a higher risk for developing infection. You're at a higher risk for bleeding. So you don't want to just go, oh, well, this is no big deal. It's just a C-section. It's something that you really want to discuss with your healthcare provider. Now, the nice thing about a transabdominal cerclage is that you really don't need bed rest. Most people will be just fine, and they can be reused for future pregnancies. So this is a potential another advantage to them, but it is something that you should definitely be having a discussion with your healthcare provider. Welcome for anybody who's joining us. My name is Dr. Samantha, and I am the maternity mentor. And we're here tonight for our live Q&A session where we answer questions that have been submitted by you, the viewers, over the last week on some of our videos. And if you have any questions that you want to put into the chat live, we will also answer those. So please feel free to put any questions you have in the chat. So I'm going to go on to a question about breast milk supply. So how do you handle an oversupply and becoming regulated? And how do you know if you've regulated? So this is a great question and can be a little challenging. So let's talk about oversupply. A lot of women may think they're experiencing oversupply, especially in the beginning, and the beginning is relative. It can be up to 2 months of age for the baby. They feel like they may have oversupply because their baby might be eating 3 or 4 ounces at a feeding and they're making 6 ounces. And so for them, they're like, well, this is way too much milk. I must have oversupply. That doesn't necessarily mean that you have oversupply. You could just have an abundance of milk. Now, what's the difference? A very common thing with oversupply are problems. That's where we get concerned. So let's start with mom. Clogged ducts and mastitis are the 2 biggest problems that somebody with oversupply will experience. For baby, you might have excessive gassiness or colic, or you might have green frothy poops. So the colic and the excessive gassiness often comes from a very strong letdown that's usually or very commonly associated with oversupply. So that strong letdown, the baby will just gulp down milk and even look like they're having trouble breathing when your milk first lets down. Additionally, because you have so much milk, the baby often will get 3, 4, 5 ounces in the first couple minutes. So this first milk is actually very high in sugar. And what ends up happening is that these babies will oftentimes end up very uncomfortable and having that green, frothy poop because they're getting too much sugar, too much lactose. So it can be very frustrating for the baby, because what we want baby to get is the fore milk, which is that high sugar milk, as well as the hind milk, which is the high fat milk. We want them to get all of it. And with oversupply, sometimes you have so much of that first part of the milk, they never get to the back part, which they also need. So what do you do about this? So there's a couple things. If you know you have a very strong letdown, some women will just choose to kind of stimulate their letdown with a little bit of like a hand stimulation. And they'll either have something to catch the milk, or they'll just have like a rag, and they'll just allow for that first letdown to happen, and then they latch their babies. And usually by the time that first letdown happens, there's the baby can then go ahead and feed enough to get that hind milk that we just said that they needed. Now, if you're going to collect that fore milk, you're probably saying to yourself, well, what do I do with that milk? Because you just told me, Dr. Samantha, that's full of sugar and it's just going to make the problems worse. So what you can do with that fore milk is you can actually label it, and you can use it with your toddler later on. You can mix a little bit of it into their foods. You can put it in cereal. That's a great milk for you to use later on in your baby's life. Just make sure that you've labeled it as fore milk, okay? Now, how do you know if it's been regulated? Hard to say if you're not having any problems. So for moms that are just going about their business, but they happen to notice that they can still pump out 2 or 3 ounces after their baby eats, they don't necessarily have this ability to know if it's regulated. Honestly, it's if you're doing well, I wouldn't think about it too much, because again, if you're only 6 weeks, 2 months into this, your body's going to keep adjusting. And your baby in 2 more months is going to be eating that 5 or 6 ounces. So what looks like too much now will actually be just right in another month or so. The other thing you want to be aware of is your baby going through a growth spurt? A growth spurt would cause your milk supply to increase all of a sudden. So maybe your baby is trying to stimulate that extra milk. Now, some women are blessed in having a really healthy milk supply that a lot of us are very jealous about. If you do have a lot of milk, one of the things you can also consider is donating your milk. And I have a video on milk donation that I will link in the description below. But milk donation, breast milk is medicine. And a lot of babies who are sick and medically fragile depend on donor breast milk. A lot of this milk is used in hospitals to treat premature babies. So if you do have extra breast milk, you can actually consider donating that to your local milk bank to be used with those types of babies. Now, if you want to slow down your milk, a couple things you can do. The most common is block feeding or feeding on one side. So what it means is, instead of doing like 10 minutes and 10 minutes, you're going to do 20 minutes on one side. And then the next feeding, you're going to do 20 minutes or 30 minutes, however long your baby eats. But basically, they eat on one side only, and the next feeding, they eat on the other. This encourages them to get the whole milk complement. But additionally, it means each breast is resting for approximately 6 hours. This is sending a signal that this breast needs a little bit less milk, okay? You can use a little bit of like the cabbage leaves if you want to, but very little, not like what you would do if you're trying to dry up your milk supply. If you're using any of those lactation teas, maybe cut those out. But definitely don't start using herbs or something that will stop your milk supply, because you can overdo it and then you're underproducing, okay? And then you just kind of keep an eye on things. If you develop any like redness, swelling, fever, anything like that, hard lumps in the breast, that's a sign of clogged ducts or mastitis, and you want to contact your healthcare provider. So, hi, Shoshana. Thank you for joining us. So you're 19 weeks and you can only feel baby moving in the pelvic area, not so much in the belly. Is that normal? So I'm going to tell you that that very likely could be normal, but you want to let your healthcare provider know. And because baby movements are very significant, okay? Now, at 19 weeks, some women still haven't felt their baby move. So I would not be super duper worried yet. If you have a lot of belly fat around your midsection, that's gonna potentially mute some of those baby movements. You're not gonna feel them as much. Additionally, women who have a lot of amniotic fluid, they oftentimes don't feel the baby's movements like the other women do. Okay, less amniotic fluid means it's easier to feel the baby move. But if you have a lot of amniotic fluid, your baby's floating around in a lot of liquid and you might not feel a lot. Now, the reason why you may be feeling it more in the pelvic area, especially if your baby's little feet are down there, is because there's a lot of sensitive stuff down there, like your bladder. So if your baby kicks your bladder, it hurts. It does not feel good. And if your bladder is full, it hurts and it makes you feel like you need to pee. So it's very, very noticeable. Your baby doesn't know what is what. So your baby's just going to kick and move however they want to. But again, if the little feet are down there and they're kicking those sensitive areas, it would be a lot more obvious to you. Now, the good thing is you feel your baby moving. The biggest warning sign we have about babies moving is if they don't move the way they normally move. If your baby's movements change and decrease, you want to let your healthcare provider know. A lot of women feel scared or silly or embarrassed to call their healthcare providers. And this may not be you, Shoshana, but this is a good illustration of why it's important to call healthcare providers. Your provider is being paid to see you 24 hours a day, 7 days a week. Your local clinics, your local hospital, that's what they're there for, okay? Do not feel silly if you're not sure if everything is okay. That's what your healthcare providers have signed up for, okay? Don't let them bully you or make you feel stupid, and call them every single time you have a question. I don't care if you call every night at 3 o'clock in the morning. This is their job. This is what they're there for, okay? Your baby's movements, if you are bleeding, if you feel like you have an infection, if you have pain, and so many other things, they need to be addressed in a timely manner. And it's better to be safe than sorry. However, that sounds like it's probably pretty normal, Shoshana, especially at 19 weeks. Okay. So that was a good question. Thank you so much. Let me go ahead and I'm going to ask a question, I'm going to answer a question about drying up milk. So this was a great question that came from a viewer. I'm 15 weeks pregnant with a 10-month-old who breastfeeds once a day and takes a bottle the rest of the day. I just found out I have to dry up my milk because contractions are being caused by the breastfeeding. Only one breast is producing milk. I need help. So this is a great question. So she's breastfeeding while pregnant. This is safe for many women, but starting contractions, when you breastfeed, you can start contractions. That is a risk. And once you're told by your healthcare provider you cannot breastfeed, you need to stop breastfeeding. Because if you are experiencing contractions, you can actually cause a miscarriage. So now you've got this milk in your breast and you need to stop producing. So one of the best things you can do is start by wearing a tight bra. Okay, you don't want to bind your breasts. Binding your breasts is where you wrap something really tight. It's very cultural for some areas. You don't want to do this. This can lead to plugged ducts and lead to mastitis, which could be bad for the pregnancy. Instead, you want to wear a tight fitting bra 24 hours a day, 7 days a week until the milk is gone. You're going to put cold cabbage leaves onto the breast inside the bra. Okay, you can put those cabbage leaves there and leave them there until they wilt, and you can put those on every single time you're taking one off. You can put another one on. Cabbage leaves have been used for hundreds of years to help dry up women's milk. The cold helps inhibit milk production, and the chemicals in cabbage can help dry up your milk. Another really good thing you can use is peppermint oil, okay, and peppermint tea. So peppermint tea being drunk can help to reduce your milk supply. And then a lot of women apply peppermint oil to their breast, or you can use peppermint oil deodorant, and that can help to dry up the milk. You can put ice packs on your breasts 3 times a day for 20 minutes. You want to make sure that if you're using ice packs that you have a cloth or something in between your skin so you don't burn your skin with the ice. When you're taking a shower, you don't want to let a lot of warm water run on the front of your chest, okay? Because warmth helps stimulate milk. Instead, you want to let the water flow on your back as much as possible, okay? You want to try to avoid pumping and hand stimulation because that can lead to your body making more milk. Now, the other thing is you have a 10-month-old who is breastfeeding once per day, and this can be very challenging to try to also discourage a 10-month-old to stop breastfeeding. You're so welcome, Shoshana. I hope that helped. So for a 10-month-old, this trick that I'm about to tell you might or might not work, but for toddlers, it definitely oftentimes works. For a lot of women, what I recommend is you put Band-Aids on your breasts over the nipples. And when you go to breastfeed, you show your baby or your toddler the breast and you say, I'm sorry, I can't. I got a boo-boo. I can't. Mommy's hurt. Okay. For a lot of children, they understand this concept, even possibly the 10-month-old, although I'm a little on the edge. And then they won't try to breastfeed because you're hurt. So they kind of recognize that they've got to work this out some other way. Now, if the one time a day breastfeeding is at bedtime, maybe ask your partner or your family to help put the baby to bed at that time so you're not around until the milk has dried up. Okay. The other thing you can do is just simply say no and offer a pacifier if the baby is taking that, or a bottle. But that's a great question about, drying up your milk and stuff. Now we have a couple questions on bleeding. I'm 4 weeks pregnant and I'm suffering from bleeding. It's a little heavy. My HCG is normal and my pregnancy test is positive. Doctor asked me to rest and gave me some medication. What are the chances the baby will survive? And she mentions that she's traveled a lot. I have another question. I'm 13 weeks pregnant this morning and I had mild bleeding. It seems to be coming on my period dates every month, like regular periods. So during the pregnancy, do periods also come? So 2 great questions about bleeding. And the reason why I put them together is a lot of bleeding is the same. Number 1, if you have bleeding, you call your healthcare provider. You call your healthcare provider because they need to assess you and determine the cause of the bleeding. Bleeding can come in a couple different colors. So you need to know your colors. It can be pink, it can be red, it can be dark red, it can be brown. Brown is a sign of old blood. This means there was bleeding at some point and now you're seeing the old blood come out. Dark red is usually a transition from active bleeding to bleeding that's stopping. Pink is usually just light bleeding, and then red is usually bright red, active bleeding is occurring. Okay. No matter the color, you still need to contact your healthcare provider, but this gives you a gauge of what's going on. But it also lets you know your doctor or midwife want to know what color it is. Okay. Now, bleeding can happen very early in pregnancy, like around that 4-week mark, for a couple reasons. It can happen because you've had intercourse. So again, the hormones that you need for a healthy pregnancy thin out the vaginal tissue. It also makes you drier. So as a result, if you have sex, it can cause little tiny tears that will spot, okay? And can cause some bleeding. This is why it's very important for you to use lots of lube when you're having sex during pregnancy, okay? Lube, which is the lubricating jelly that you use, it's safe for your pregnancy unless your healthcare provider has told you otherwise. It's not going to hurt the baby. And it can actually be better for you because it can reduce your risk of bleeding due to a vaginal tear. And a vaginal tear can lead to infection. So use lots of lube. Additionally, at 4 weeks pregnant, you might still have some implantation bleeding. And implantation bleeding is when that fertilized egg is attaching to the uterine wall. Sometimes there's something called a subchorionic hemorrhage. This is like a little pocket of blood underneath where the placenta is developing or has developed, and you may get a little spotting. This can also be very benign, nothing that's going to harm the pregnancy long term. But this would be a great example of why your healthcare provider needs to know, because most healthcare providers are going to want to do an ultrasound to check and see what the cause is. Now, another cause could be a period. So that leads us to the second question. So this mom's saying, I'm getting what appears to be a period every single month at the exact same time I should have got my period. This does happen for some women. Some women will continue to have their period for sometimes the first trimester, second trimester, the whole time. It can be normal, but the healthcare provider is going to monitor that. They're going to be checking the baby. They're going to be checking your HCG levels. That's the pregnancy hormone in your blood. They're going to be making sure everything else looks okay. And then they may just determine that this is you. Now, the other thing is there are women who are born with different uterine types or abnormalities that they may not know about until they have their first pregnancy. One of them could be a bicornate uterus, which is like where you have two of them. So sometimes women will bleed from one side and not the other. Very rare, but it's possible. So one of the things that you want to do is make sure you let your healthcare provider know. But you can bleed during pregnancy and be safe. The baby can be fine. You can be fine. Everybody can go to full term and be happy and healthy and normal size. Bleeding does not necessarily mean that the pregnancy will not go to full term. Thank you for that question. Hi, Juanita. I see your question. So my mother had preeclampsia with my older sister 27 years ago, and I'm scared that I will also develop preeclampsia. Should I be referred to maternal fetal medicine? So I'm going to tell you yes. Okay. Maternal fetal medicine is probably going to laugh at you, just to be very honest, because they're going to say, if there's nothing going on, why are you here? But you need to advocate for yourself. So with a family history of preeclampsia, you are at higher risk for preeclampsia. Okay. Now, one of the bigger things that you should be doing is you should be trying to make sure that you are monitoring yourself towards the end of your pregnancy. Know those warning signs for preeclampsia. So preeclampsia is often associated with high blood pressure. So you want to make sure you have a blood pressure machine in your house that you know how to use. You also want to make sure that blood pressure machine is properly sized. This is where a lot of people go wrong. So if you look at the blood pressure cuff on the outside, it has these measurements, either in centimeters or inches. That's telling you what size forearm it's good for. A lot of blood pressure kits, they'll come with a paper tape measure. That's for you to wrap around your arm and to measure the size of it, because you want to make sure the size of your arm matches that blood pressure cuff. If the cuff is too big for your arm, it will give you a low blood pressure reading that's not accurate. If the cuff is too small, it will give you a high blood pressure reading that is not accurate. And the most important thing for monitoring with preeclampsia is an accurate blood pressure. So you want to make sure you have a properly sized blood pressure cuff, and you want to check the size of your arm as you gain weight throughout your pregnancy. Now, some other things you do for monitoring for preeclampsia. You want to weigh yourself every day. Now, I'm not trying to get anybody crazy about their weight, where we gain weight during pregnancy. But one of the signs that preeclampsia could be setting in is sudden weight gain. This is where all of the sudden, like overnight, you gain 2 pounds, or overnight you gain 5 pounds. That is swelling. That is not a normal weight gain, and that could be a warning sign. So you want to make sure that you're monitoring your weight so that you can keep an eye for a sudden change that might be an issue. At the same time that you have that sudden change, look for swelling. So you can look for swelling, especially in your face, your hands, or your feet. Okay, these are really big places that people will get very swollen due to preeclampsia. Now, other signs, headache. Okay, a lot of people will get a headache with preeclampsia. Do not ignore headaches that seem to be different, okay? A lot of us have headaches, but this headache usually feels a little different, but no matter what, you should not ignore, especially with a history. If you have changes in your vision, so this could be blurry vision, this could be tunnel vision, this could be spots in front of your eyes, this could be flashes. It could be anything that doesn't feel normal for you in your eyes. That can be a warning sign. And finally, pain in the upper right abdomen. So this part of your abdomen is kind of over your liver. A lot of women will experience pain there, and that's often associated with issues in the liver that develop due to the preeclampsia, because preeclampsia is usually high blood pressure and some kind of organ failure. It's either liver, and so we usually will test the liver enzymes to see if they're high, which is common, or it's kidneys. And the way we tell our kidneys are an issue is because we will have that high blood pressure and moms will have protein in their urine. Okay. So if you get this pain here, it's another thing. And don't discount heartburn that comes on all of a sudden if it's on that side, because that actually could be that sign. Be an advocate for yourself. Definitely ask to see the maternal fetal medicine doctor. That's what they're there for, and they can help to counsel you and give you good advice moving forward. The other thing I'll finally say about this, Juanita, is if you are able to meet with a maternal fetal medicine doctor and they get your history and they do that intake, if you were to develop an issue, you are an established patient, which means it's easier to get in if a complication arises. And you also know who you're speaking to. You've already met this person in a period of time that was calm, versus if you're having a complication and now it could be kind of like chaos. So that's a really good question, Juanita. Thank you for asking that. So our next question came to us, and I'm not going to read the whole question verbatim, but this is basically a mom who's having a planned C-section. And this is not her first C-section. And she was wondering if I had ever heard of a baby being able to go home right away while she recovered in the hospital, because she doesn't breastfeed, she formula feeds. So as far as she's concerned, she would like the baby to go home and be with her husband. And she said that she was thinking, it'd be better for her because then she can sleep for those nights. Dad can bond with the baby and different things like that, so that, the baby's care is being prioritized at home and her care is being prioritized in the hospital, because they're focused on her and not her and the baby. This was an interesting comment. And the reason why I actually wanted to bring it up, you're welcome, Juanita, is because one of the things that was mentioned is that it didn't seem to be necessary to have all the newborn checks. Babies, at least in the United States, need to stay in a hospital for 18 to 24 hours, usually a minimum of 24 hours. After 24 hours, babies are able to go home. There's a lot of stuff medically that needs to happen with a baby in those first 24 hours. First of all, babies don't automatically feed well just because they're getting a bottle. Totally pro bottle, totally pro breast, whatever you want to do is fine. But babies who are born at 37 weeks are premature. So a premature baby born at 37 weeks does not have great suck-swallow coordination, and they may not be able to latch to a bottle or eat well. Now, I say 37 weeks, but C-sections that are planned usually happen at 39 weeks. But if your gestational age is off, if your dates were off, you may deliver at what we think is 39 weeks, and it's actually 37 weeks. 37-week babies, 38-week babies, they can have trouble with their blood sugar. They can start to develop jaundice. And we have a video on jaundice that we can link in the description. But jaundice is a condition with an immature liver that can cause life-threatening complications for the baby. So we need to make sure baby is eating well and is able to maintain all their normal functions. Now, additionally, babies are born with a hole in their heart. Most people don't realize this, but this is actually normal. So there is a hole called the patent duct and arteriosus, which is there for a reason while a baby's in your belly. It's perfectly normal. Everybody has it. When the baby is born, the baby's hole is supposed to close. And it normally does this without any issues whatsoever. But for some babies, it doesn't close, and there's a murmur. And that murmur is listened to by a doctor in the hospital who's checking your baby. If that murmur is noticed, it's probably going to go away. It's like 99% of the time, nothing. But very likely they're going to monitor the baby. They may order a couple tests to make sure the heart looks good, or they may refer you to a cardiologist to triple check everything. So these are some of the reasons why babies need to also stay in the hospital during that time. Okay. Now, for moms who deliver at home, one of the things they may say is, well, the baby doesn't go to the hospital after I deliver in my home birth. But for these women, there is a trained midwife at the birth who's doing a whole bunch of stuff. And oftentimes these midwives are checking back in, sometimes at 12 hours, 18 hours, 24 hours. Like this is part of what they do. They are actually checking the baby. They will oftentimes encourage you to get that baby to a pediatrician right away. And it's not to say there isn't a risk for having your baby at home and not being monitored. Most babies are going to be just fine. Full-term healthy babies are usually just fine. But there is a reason why when you're delivering in a facility, even in birthing centers, that they're going to want to keep the baby for the 24 hours. I see a couple of you are joining in. We're almost done. I'm going to answer one final thing tonight. And I do have some stuff that didn't get answered, so I'll probably try to answer those next week. The last questions are about placenta previa. So I had somebody say that her doctor never told her what type of previa she has. She's 23 weeks pregnant, and she was just told about this. She's not had any complications. She's been having intercourse and everything, no issues. She's very concerned because culturally she says she's not supposed to have blood transfusions or a cesarean section. And she's devastated to hear this, and she's hoping it will resolve. So it highlighted that some of you may not know what type of previa you have. So we have a uterus, we have our cervix, and so here's the uterus. So a placenta is the organ that feeds the baby, and it's supposed to be on the side of the uterus, okay? It usually plants on one side or the other. And it doesn't come down near the cervix, okay? A previa is where the placenta is over the cervix. So there are 3 types. The first type is a complete previa. This is where it's completely covering our cervix, okay? This is the most serious of all the previas. It requires a C-section no matter what. If it stays covered, you're having a C-section, and usually you are having a C-section early. 34 to 36 weeks, it just depends. So remember, contractions, what happens with the contraction is the uterus kind of pulls like this, and it starts pulling this cervix apart because remember, the cervix has to open for a baby to come down, right? So if you have a placenta, which is the organ that's full of blood to feed your baby sitting over this opening, and this opening opens, you are going to start bleeding out, and baby's going to start bleeding out. And we're going to have a medical emergency on our hands. So to prevent that, we have an early C-section. The second is a partial. This is where it's kind of half and half over. So with this type of previa, it just depends on where things end. As the uterus gets bigger, some of these placentas will move. They'll migrate up. If a partial is early enough on, that placenta may move, and that may allow the cervix to be completely clear of a placenta, and you can have a regular vaginal birth. But if it really does stay pretty much half and half, it's very likely you're going to need a C-section for the same reason. And then finally, there's a marginal. So marginal is where like just a tiny little bit of it is over the cervix. And again, most of these will move as the uterus gets bigger, but sometimes they don't move, and we have to do a C-section. But the reason for this is because there is a chance to bleed out. Now, if culturally you aren't able to receive a blood transfusion, you want to go ahead and have a conversation with your healthcare provider about this because there is a risk for postpartum hemorrhage. And we have, we'll put in the chat links for postpartum hemorrhage and for receiving a blood transfusion, so you can get some more information on that. But that is a conversation you need to have with your healthcare provider. But it's something that hopefully it resolves itself, but you might need to have a C-section. For those of you who are joining us, thank you so much for coming. This video will be posted after the live ends, which will be in just a minute or two. We'll post it on the channel so you can go back and you can hear the answers to some of these questions. We do this every week. 9 p.m. Eastern Standard Time. We're here live to answer questions that have been submitted on our videos. If we don't get to your question this week, we try to answer it next week. And we also will answer any of the questions that you put into the chat. That's what we're here for. We want to give you the best information. Remember to share a channel with your friends and family. Follow us on Facebook, Instagram, and Twitter. Before I sign off, I just want to say that I had a dad, Boss Donetti 5656, comment on a video. Where are all the dads? Don't be nervous. Be strong. You got this, Kings. I love that comment, and I wanted to give the shout out. I'm very passionate about helping moms, but I'm also very passionate about helping dads and partners. If dads and partners are feeling strong and good and not nervous, they help moms out significantly. It's definitely a team effort, and we want to make sure dads and partners are just as involved as moms, because it's so essential to a happy and healthy mom, pregnancy, and family. So I loved that comment. Thank you so much for putting it out there. Without further ado, thank you so much for joining us. My name is Dr. Samantha. I'm the maternity mentor, and I'll talk to you later. Bye.